Welcome to the weekly checkup on ReachMD for the week of February 8th, 2016. This week's news report dives headfirst into what was once believed to be the stuff of science fiction. Scientists at the Francis Crick Institute in London have approval to begin genetically modifying human embryos. While it will remain illegal to implant these embryos, a large moral and ethical outcry has risen concerning the future of such experiments. Opponents claim that this study will open the door to genetically modified or designer babies. Meanwhile, the research teams counter that this experimentation on non-implanted embryos will yield important discoveries on the origins of miscarriages and infertility. To follow continuing updates on this controversial new research direction, head to ReachMD.com. ReachMD continues this month's focus on heart health. Take a look at how the transition from childhood to adolescence affects care coordination for pediatric patients with congenital heart disease. With nearly 2 million American children and adults living with congenital heart defects, this poses a vast array of needs for cardiac health professionals. To learn more, check out the segment Transitioning Cardiac Patients from Pediatric to Adult Care. And now for a quick look at some of our latest featured content. It turns out there are different kinds of safe sex talk you should be having with your patients, particularly those with osteoporosis and other disorders affecting bone density. In the latest episode of SexMed, clinical experts in sexual health focuses on the effects of fragility fractures on intimacy and sexuality. Learn how to better recognize and treat the myriad of sexual issues your patients with osteoporosis may develop. This week's video highlight explores ongoing consideration from experts in medical education for ways in which indirect payment reporting, transfers of value, and disclosures have changed and will continue to evolve under the Sunshine Act. This and more captured in the latest episode of Voices from American Medicine.
So we're going to talk about the Sunshine Act today, and maybe Andrew, you could start by telling us what it is and what the latest is in the Sunshine Act.
Sure. Well, Frank, as I'm sure most of your viewers are well aware, the Physician Sunshine Payment Act was passed as part of the Affordable Care Act a couple of years ago. And effectively what it is, it's a provision that is intended to bring transparency to payments that transfers of payments between pharmaceutical companies, medical device companies, and doctors and GPOs and teaching hospitals, that others that were sort of considered in this category of covered entities. But mostly we should focus on doctors, because it was really intended to create a national database that would be available to the public, such that patients could track to see whether or not their physicians were receiving payments in any regard from pharmaceutical and med device companies. In the original act, it was pretty clear that it was not intended to capture, for reporting purposes, CME-related payments. That's to say, payments that are independent of any sort of direction from a commercial supporter or pharma company to a doctor. So, for example, when a physician goes to or speaks at an accredited CME event, it might be underwritten by, in part, a pharmaceutical company or medical device company, but a company that provides, under accredited rules, an independent fund, an independent grant, but exercises no control or influence over the curriculum or the selection of speakers or the selection of attendees. That's the definition of independent education.
Right.
And in those circumstances, the commercial supporter does not have any relationship with the speaker or with the attendees, and the assumption is, and was under that original act, the way the act was written, that therefore there's no reporting that takes place, because if a commercial supporter isn't actually, instructing that the money go to a particular doctor or doesn't have any involvement in making that happen, then there's nothing to report.
To hear more on this topic, check out the segment All Things Educational. A panel discusses independent CME, the Sunshine Act, and reporting. For more featured content, head to ReachMD.com or listen in on any of our recommended platforms. Thank you for joining us today. I'm Sherry Neely, as always, inviting you to be part of the knowledge.